Local nurses are calling for change as the healthcare staffing shortage continues to impact the state of Oregon. The State Nurses Association is proposing new policies to better retain its employees. The Oregon Employment Department says healthcare has consistently had the most vacancies of any industry since 2013. But pandemic burnout and vaccine mandates have only made things worse, they say. Fox 12's Mia Villanueva joins us now with the policies that nurses believe can bring some much-needed relief to our state's healthcare systems.
The Oregon Nurses Association met today to discuss ambitious policies to retain nursing staff at hospitals and other healthcare facilities. One of those policies includes asking hospitals to pause their plans of returning to operating at maximum capacity. This comes as 60% of nurses at OHSU indicated they are considering leaving the profession entirely. That's according to Matt Calzia, registered nurse and member of the Oregon Nurses Association. He's also called for hospitals to honor meal and rest breaks for nurses and to stop relying on traveling nurses to meet demand. He says they instead need to turn their attention to retaining existing nursing staff at hospitals or otherwise risk perpetuating a cycle of them leaving their jobs to become travel nurses for better pay.
We are seeing that up to 30% of the nursing staff in some hospitals are travelers. In other hospitals, turnover is so high that the majority of a unit might be composed of traveling nurses during some shifts. All hospital systems must begin planning for how we can wean ourselves off traveling nurses and turn those resources toward retention pay, incentives for existing staff, and improving the nursing work environment.
The Nurses Association is also calling on the Oregon legislature to expand the Oregon Wellness Program to include a provision of mental health services for nurses. They are asking for $1.8 million biannually to support the expansion. Nurses also called upon the governor and the Oregon Health Authority to create a commission to engage in a systematic review of Oregon's overall healthcare staffing models in order to strengthen them. The meeting also addressed the upcoming October 18th deadline for all nurses in Oregon to get vaccinated against COVID-19. Linda Pons, the president of the Nurses Association, says losing just one more nurse to the mandate will cause an even greater strain on our healthcare systems. Reporting in Northwest Portland, I'm Mia Villanueva, Fox 12 Oregon.